we are going to read about Mendelson syndrome today. So it's a very important topic for PGME examination. Okay, what is Mendelson syndrome? Mendelson syndrome is a chemical pneumonia. It's a chemical pneumonia. It's very important to read about this. It's a chemical pneumonia which is caused by aspiration of gastric juice. Aspiration of gastric juice. Then aspiration of gastric juice during anesthesia and induction. It may be during anesthesia or induction of anesthesia. Okay, so guys, if my video is slow, then watch it at 1.25 speed in YouTube. Okay, so now if the pH of the aspirated fluid is less than 2.5 and the volume of aspirate is 25 ml, that is in adults, or you can say 0.4 ml per kg of body weight, then there is a greater potential for causing chemical pneumonia, which is also called as Mendelson syndrome. If the pH of the aspirated fluid is less than 2.5 and the volume of the aspirate is 25 ml for the adults, or you can say 0.4 ml per kg of the body weight, then it has a greater potential for causing chemical pneumonia. That is Mendelson syndrome. Okay, now the mean critical pH, and the critical volume for Mendelson syndrome is 2.5 and it is 25 ml. Okay, this is the mean thing. Okay, so when does this Mendelson syndrome happens? We have read it earlier, during induction and during anesthesia. So most commonly it happens during induction of anesthesia. Most commonly the Mendelson syndrome happens during induction of anesthesia and also during introduction of tube in the glottis. Okay, so this is the main this is the most common time when Mendelson syndrome happens. Okay, however, it can happen anytime. It can happen anytime during anesthesia. Okay, so what are the predisposing factors for Mendelson syndrome? Okay, the predisposing factors for Mendelson syndrome, the single most single most important predisposing factor for Mendelson syndrome is full stomach patient. Okay, this is the single most predisposing factors. Other predisposing factors are pregnancy. Pregnancy patients are always considered full stomach patients, and obesity, hiatus hernia, what are the other things? Comatose patient, where consciousness is deranged, and abdominal tumors, because intra-abdominal pressure is raised in such patients. GERD, history of GERD, and diabetes mellitus, bowel obstruction patients. These are the predisposing factors for Mendelson syndrome. Okay, now aspiration of gastric contents causes severe chemical inflammatory change. What does aspiration do? Aspiration causes inflammatory change. Okay, and this inflammatory change predisposes to infection in lungs. Okay, so this is very important. Okay, clinically there is acute onset of symptoms. Okay, generally within 30 minutes. What does 30 minutes of the event? What are the things which happen? Then respiratory distress, okay, rapid breathing, that is tachypnea, okay, audible wheeze, okay, cough with pink or frothy sputum. There may be tachycardia too. These things are there when the aspiration occurs. What is the treatment? It's very important. Treatment includes head down position, okay, head down position, okay, suctioning of pharynx and trachea, okay, oxygen supplementation, okay, mechanical ventilation, this includes intubation and application of PEEP. Okay, IV fluids and most important, antibiotics. It's very important. Okay, one thing which is very important to note is that use of corticosteroids is generally not recommended. Okay, so now how it can be prevented? Prevention, because prevention is always better than cure. Okay, so prevention, there is no foolproof method of prevention. No foolproof method of prevention is there, but we have to follow a well-established practice which minimizes the risk of aspiration, that is Mendelson syndrome. Okay, so what are those? One, adequate pre-op starvation. In general practice we also call is NPO timing, nil per oral timing. Some people say NBM, nil by mouth timing. So okay, it's very important to learn what are the timings of, what are the NPO timings. So for the clear fluids, very important to note, for clear fluids it's 2 hours. What are the example of clear fluids? Then it is water, apple juice, for breast milk it is 4 hours, for infant formula it is 6 hours, and non-human milk it is 6 hours, and for light meal it is 6 hours. These are the pre-op starvation guidelines, pre-op fasting guidelines as per Barash. Okay, what are the other methods? That was the first method. Second method for prevention is use of prokinetic drugs. Prokinetic drugs. What is the prokinetic drug which we use? Is metoclopramide. It increases the gut motility. Okay, and increases and hasten gastric emptying. Okay, What is the third method? Is decreasing pH of gastric contents by H2 antagonists, that is ranitidine, okay, and neutralization of acid by sodium citrate. Okay, it is very important. Okay, what is the other method? Other method is use of regional anesthesia such as blocks, spinal anesthesia, epidural anesthesia, wherever possible. So what happens in these things? The patient is awake, so reflexes are preserved, so there are no chances of Mendelson syndrome. Okay, so now what is the next method? Is rapid sequence induction. This will read as separate topic. It is also known as RSI, mainly for the full stomach patients. There is something called Selleck's maneuver. Okay, Selleck's maneuver. What we do in Selleck's maneuver is we apply back pressure on cricoid cartilage. Okay, we apply back pressure on cricoid cartilage. What does it do? It is done for prevention of regurgitation of gastric contents and its leaking into respiratory tract. Okay, the pressure which is applied from the starting of the induction. Okay, it is applied from the starting of induction and it is maintained until intubation and inflation of the cuff of the ET tube. Okay, after inflation only the pressure is removed. What is the hypothetical basis of Selleck's maneuver? Hypothetical basis is that the pressure on the front of the cricoid cartilage is transmitted to the posterior lamina, which what does it occludes the esophagus by compression against the vertebral bodies. Okay, this is the hypothetical basis. Okay, what are other ways? Is awake intubation. Awake intubation prevents Mendelson syndrome by decreasing aspiration. This is all about Mendelson syndrome. Thank you.